My name is Michael Sobolevsky. I'm a podiatrist, which means I'm a foot and ankle specialist. I treat kids to the elderly. Any pathology, any issues that happen to fall in the foot and ankle is my area of expertise. What attracted me to foot and ankle pathology is the fact that if a patient comes into my clinic, there's always something I can do to get them to walk out feeling happier and better than they did before walking in. We do treat a lot of diabetic foot issues. We see a lot of diabetic foot complications, and my job is to see these patients, treat them with the utmost care and diligence to make sure that we don't risk any complications such as infection or amputation. We try to get these patients back on their feet, get them back to work by any means possible before we have to go in and do any type of surgical treatment. My favorite part of my job is really the interaction with the patients. I'm a people person. I like to hear about people's lives, about their past, about their goals, their future, their families. It's all about making a patient feel heard and special. And I have built up a rapport with patients that ask about my family, my kids. It's important because it makes a patient feel comfortable with my treatment plans, my decision making on their conditions. You have done a good job when you've had to do an amputation because of a diabetic complication, and the patient comes back and thanks you for the work that you did. She was grateful that you're able to stop the progression of the infection, and despite her, amputation, she was very happy about the job that I did and the care that I provided her. I decided to go into medicine because it's one of the fields that truly helps people get their life back together. And if there's anything I can do to make it better, it brings me great joy to get people healthier and back on their feet.